When I was 17, I was diagnosed with epilepsy. I started to have lots of tonic-clonic seizures, partial seizures, and was hospitalized several times because of that. So at that point, I became obsessed and in love with the brain. Not just epilepsy, but other diagnoses such as ALS, MS, Parkinson's disease, and of course, stroke. What led me directly toward wanting to work with people who have had a stroke is my close work with my mentor, Dr. Susan Fasoli, who worked with combining robot assisted therapy and rigorous occupational therapy services for a really holistic program. Ultimately, I want to teach a patient how to be their own therapist, right? A lot of times we assign home exercise programs or tell a patient what to do, but I want to make sure that you as a patient know why you're doing what you're doing and how it's going to make a real functional change in your everyday life so that in the long term, you can be your own therapist and use your problem solving skills in order to complete a meaningful or purposeful activity. We as occupational therapists, we like to take a holistic approach. So I'm not only concentrating on your physical impairments or your ability to engage in certain activities, but I'm also looking at things like mental health. How are you doing? Is there a way that we can tackle that as well so that you can have the highest quality of life possible? Imago Rehab uses a very unique and novel approach when it comes to stroke rehabilitation, and something I had never used prior to joining the team. So, the first thing we like to say is life is therapy. This is occupational therapy. So, we're working on those meaningful and those purposeful activities that you need to do on a daily basis. But what's a better way to approach that? We are not just a home exercise program. It's much more comprehensive than that. And the first approach I think is the most interesting is this cognitive component. We want to work with you so that you can develop your own strategies to increase your independence in your everyday activities. For example, if you're having some difficulty with elbow extension, what are some different strategies that we can use so that you're able to do that on your own outside of our therapy sessions together? There are many strategies that I, as an occupational therapist, use in order to ensure that patients have long lasting change or improvement. And the first and most important of those is teaching the patient how to be their own therapist, changing their way of thinking when it comes to doing an activity or engaging in their movement practice. And how can we get the patients to develop their own strategies for problem solving that can be used well past their time at Imago Rehab? A lot of times in therapy, we focus too much on home exercise programs, different repetition. What is our ultimate goal as occupational therapists is to make you more independent in the everyday activities that are meaningful to you or that you have to do. So, yes, repetition is important. We need lots of that, but always take it back to function. What are your functional goals?